One of the most surprising things after having a baby can be the amount of swelling that actually gets worse before it gets better. It is often a normal part of postpartum recovery, but how do you know when it is something more serious? Rapid fluid retention after birth becomes serious when it is accompanied by other specific symptoms, especially those related to elevated blood pressure. While mild swelling, also known as postpartum edema, is common due to body fluid shifts and intravenous fluids during labor, sudden and significant fluid retention, particularly in the face or hands, could signal a serious underlying condition like postpartum preeclampsia. The seriousness primarily stems from the risk of preeclampsia, a condition characterized by high blood pressure and signs of damage to another organ system, most often the liver and kidneys. Even if you did not have preeclampsia during pregnancy, it can develop after birth, typically within the first 48 hours but sometimes up to 6 weeks postpartum. The body's hormones are shifting dramatically, and combined with the physical stress of childbirth, this can sometimes lead to unexpected complications involving blood pressure regulation and fluid balance. Your body is working hard to return to its pre-pregnancy state. To help monitor your fluid retention, regularly check for new or worsening swelling in your face or hands, not just your ankles and feet. Pay close attention to accompanying symptoms like a severe headache that does not improve with over-the-counter pain relievers, changes in your vision such as blurry vision or seeing spots, upper abdominal pain typically on your right side, or nausea and vomiting. If you notice any of these symptoms alongside rapid fluid retention, contact your healthcare provider immediately. It is always better to be cautious and seek medical advice rather than to wait. Understanding the difference between normal postpartum swelling and serious fluid retention can be life-saving. Normal postpartum edema typically improves within a week or two, often starting to decrease around day 4 or 5 after birth. It commonly affects the lower extremities and is usually not accompanied by other severe symptoms. Serious fluid retention, however, particularly when linked to postpartum preeclampsia, requires immediate medical intervention to prevent further complications such as stroke or seizure, also known as eclampsia. Staying informed and recognizing the warning signs empowers you to advocate for your health during this important postpartum period. Your body goes through significant changes after childbirth, and knowing when to seek help for conditions like rapid fluid retention ensures you get the care you need to recover safely and completely.